Hi everybody, Dr. Anjana Vana here and welcome back to my YouTube channel. We are with Zakiyya today and she's currently got some topical anesthetic on. We're going to do something called NCTF HA for her, some micro injections under the eyes and in the lips. And Zakiyya, you just had a dermaplaning facial, hey? So she's all glowy and her skin is prepped. So it was, I wasn't in here for it, but it sounded really nice. So it was dermaplaning.
Amazing, so relaxing, eh?
It was cupping, dermaplaning, gua sha, massage, and steam. So it's a really, really nice pick-me-up treatment, especially if you've got a function, and it's a nice way to get rid of peach fuzz without threading. And if you've got if you've got an event, it gives you such a nice glow, and it's a form of exfoliation as well. So now we're going to go a little bit deeper into the skin. So what are your concerns? I know you like having your lips plumped up a little bit. That's one of the things, but I know one of the other things that does concern you is the area under your eye. So
yes.
So tell me a little bit about that.
So generally you can see I have just a little bit of fine lines.
Yes.
And I have a little bit of loss of volume underneath my eyes, which kind of bothers me.
Okay.
I always tell you have the most amazing perfect under eyes.
No, I don't. I mean, there is also some loss of volume and
Usually,
all of that.
when I see you, I always tell you I want to look like I'm going to have you under eyes.
Yeah. So today this would be the fourth or third time I think you're having the treatment done under the eyes and in the lips with NCTF HA 135. So it stands for New Cellular Treatment Factor. It's been around since 1978 and it's won awards before, but last year at Monaco at the AMWC it won Best Medical Injectable Device, and also this won an award. So this kind of goes with the NCTF. It's called Nanosoft needles. So we'll be doing these little injections under your eye. So it's really, really these tiny, tiny needles. It's patented for the delicate skin under the eye, and it's got 60 actives, minerals, vitamins, amino acids, 15 milligrams of hyaluronic acid. It's this cool pink color. It's got some vitamin B12 in it, and people go crazy for glutathione. It's got glutathione in it, so for a bit of brightening. So it strengthens the skin under the eye. And you mentioned loss of volume, so it also increases collagen production by 256%, and you also take oral collagen. So it's a nice combo. So I'm excited to do this treatment for you. So we're gonna start. Strong disinfectant there. Okay, so you might feel a little, even though you're numb, might feel a little bit of a pokey here there.
Okay.
So there'll be these little bubbles that are formed, them, and they go away maybe in an hour, so depending on skin quality. So you've done these treatments before, you take good care of your skin, so your skin's a little bit thicker, has more integrity, and you'll find that this will go away a bit sooner. But if someone's got really, really thin skin, it might take a bit longer. And then just the corners here, so this is the nice thing about this NCTF. Sometimes I use a little, it's called a Mesorel needle, so it's a mesotherapy needle. But this is really nice for the thin skin of the eyelid, and often, especially in us people of color, but not only, also white patients, you get a bit of discoloration on the lid, and sometimes we don't treat the lid, and there's also a bit of crepiness that happens. So this is really, really nice to improve the quality of skin there in a gentle way. You can also combine this with peels that are designed for just around the eye, radio frequency, but maybe radio frequency without the RF needling. And then, we're opting not for fillers for Zakiyya. And a lot of people, under eye filler is like technique sensitive, and they call it tiger territory. And, if not done correctly, months or years later, you can have persistent swelling in the area. And filler lasts a lot longer than you think. And not everyone is a candidate for it. Like, it's like, yeah, sometimes you wake up in the morning and it's puffy under your eyes. Hey, you get a bit of puffiness. So because of that, because you have that inclination for puffiness under the eye, for fluid retention, or poor lymphatics, you might not be like a good candidate, and it might not be a good idea to put a hyaluronic acid filler under your eyes, because that also puts pressure on your lymphatics and the venous drainage around your eye, and it also absorbs 1,000 times its own weight in water. So you might even get puffier. And there's something called malar edema. So like the people that get puffy here, so it leads to that long-term puffiness in the cheek.
Compared to filler, what sort of effect does this give? Does it give? Is it comparable or not really?
Not really. Depends. So people like often ask, what is better? Okay, so this isn't Botox per se. They'll ask, what is better, Botox or filler? And the answer is always, it depends, and what the diagnosis is and patient factors are. So if someone has no edema or no like water retention around their eyes, they've got hollowness, actual volume loss in the cheek and under the eyes, they'll be maybe a good candidate for hyaluronic acid filler under the eye. So that just has a bit of volume replacement. It also, because of the filler stretching the fibroblasts, you also have a bit of collagen production improvement in skin tone. So this doesn't necessarily replace volume the way a filler would. So, this is uncross-linked hyaluronic acid. So the HA in this is just like delivering it gives you like hydration. It does, stimulate the collagen, but it's also delivering the all that, like that active vitamin, those 60 actives, but a filler is cross-linked hyaluronic acid. So it is there for some time, filling and the volume, creating like a cushion that disguises your volume loss, because what's happening around your eyes as you age, it starts from your bone. So the orbit is nice and round when you're younger and a certain size, but as we age, you get something called bony resorption, which means it starts wearing away. It becomes more sort of rectangular, ovoid, and it gets bigger and bigger. So it's almost like your eye is losing support and falling back. I know that sounds horrible, but then you losing fat under the eye, and there's like a retaining ligament here that creates something called the tear trough. They call it tear trough deformity, and they say it's actually not a nice thing to say deformity, because some people are born with that tear trough deformity. Like you see little babies, they've also got that hollowness. So there's that ligament. So there's lots of different things that are happening around the eye, and they might need different treatments. Like for some people, they're a good candidate for filler. You get that immediate volume replacement under the eye, and you put some in the cheek. Some people, if there's like a pinch test, so one of the things that excludes you is that morning time puffiness. But say I pinched your skin and a snap test, there's very poor elasticity, so the skin takes like forever to go back to place. And if you put filler under that, the skin can't support the filler, so you'll get lumpiness, you'll get swelling. So doing something like this might be more beneficial. So this mesotherapy, regenerative type treatment is to improve the skin quality, but it can't 100% do what a filler would do. Like maybe repeated treatments, you get volume improvement, and maybe in combination with peels and things like that, you'll get that volume improvement, but it's not placed deep on bone like the filler would be so, but you can combine the two if you're a good candidate. And then just another sort of misconception. So all of these things, like this is technically a medical device. So even though there have been cases where we do PRF or PRP and these sort of things, and you can still get that swelling under your eye or that malar edema, but it's not as, it's more transient than if say a filler. So like with fillers, the oldest filler I've ever dissolved under the eye was 8 years old. So it was, you know, it was there. It was a patient. We hadn't done that filler, but it's also quite a like traumatic thing, I think, to dissolve filler anywhere in the face for the patient, because they get used to that look, and then you get very dehydrated afterwards. But so, you know, forming a relationship with the person and like, you know, there's something that's not right under your eye. This is what it is, and then you can use we've got an ultrasound, so you can use an ultrasound target where the filler is and dissolve it, and then you get like a resolution of the swelling and that appearance under the eye. Yeah. Sure, I hope I answered the question. I should have been just like, you know, the simple answer is like, no. That's just it. No, it's not the same.
The more information, the better.
Yeah, so this is not like a filler. I can't do exactly what the filler will do, but it's a good way to regenerate the area around your eye. So wait, I was still disinfecting your lip. That's what we are going to do. Disinfect the lip. Okay. So this is also not like, you know, the same, not like a filler. So this swelling that you see doesn't last, but it does in a small way build your own volume by increasing the collagen and the quality of your lips. So it's nice for maybe people who don't want lip filler, or have got those lines around their mouth, they want to hydrate. Also, it's very popular with guys, in fact, because, you know, some of them don't want to do filler in the lip, and then they do this instead to hydrate the lip and to give it a little bit of volume. The last time you had this, what did you think?
I liked it, I felt my lips look very luscious.
Yes.
If I can explain.
Yeah. Also, if you want to try out filler, you're not too certain about lip filler, it's a good way to have like a tryout.
Yes.
Okay. Zakiyya, go in. So it's just a nice way to rejuvenate the area. But yeah, it's amazing that since I started in aesthetics, NCTF has been around, and it's not just for eyes and for lips. You can use it wherever you have skin, your elbows, your knees. They use it on your chest for sun damage. And besides injecting this in, Sheetal also needles it in, so you can also needle it in. One of the other things we used to also use it for is our hair rejuvenation treatments. So it's like a do-it-all. It's a really nice, versatile treatment to have. And there we go. It's like you can have a look. I mean, you look all bubbly and whatever. But you know, that'll settle down, and then there might be a bit of tenderness in your lip because of the injections, but that'll also settle down now. Okay guys, thanks so much for joining me for our YouTube video, and thank you Zakiyya for having the treatment done with us and showcasing your treatment. So a great treatment combination that was performed today. Really nice if you've got an event over the weekend, low downtime or no downtime. You had a dermaplaning, gua sha, cupping, facial, and we just did some NCTF injectables, so giving you some under eye glow like an eye bright and some lip lusciousness to take you into the weekend. So if you guys have any questions about any of the treatments performed today, what was used, and Zakiyya asked some really nice questions in the video as well, please drop them in the comments, like, share and subscribe. Bye.